Thank you, Daktari. And thank you, my fellow healthcare workers, for taking time out of your busy schedule to attend this, I feel, very important session. This session is, like Dr. said, is going to be one amongst many on commodity management cycle SOPs. So before we start, I'd like to define an acronym there that maybe some might not know. What is an SOP? SOP by definition is standard operating procedure. I'd ask myself, why SOP? Why do people need to learn about this? SOP is a written set of instructions that are used to define a repetitive task so as to ensure that that task is done to the best quality. There's a very good quote that I like that defines the whole spectrum of quality. Remember, the success of any organization lies in its ability to deliver quality services. Therefore, we as healthcare workers must endeavor to put quality at the forefront of everything that we do. So we'll go to our first slide. So this is just going to be a presentation of the SOPs that we're going to do over a duration of time. For today, we are just going to do number 1, 2, and 3. Number 1, 2, and 3 entails an SOP for writing SOPs. So we must have an SOP for writing other standard operating procedures. It's very important because there is a process to it. Why do we need to have this process? We learn that as we move on. Secondly, because we're talking about commodity management cycle, the commodity management cycle starts at the point of selection and quantification of health products and technologies. This is the head, I would call it the head of the whole procurement cycles. We'll talk about procurement for those who are savvy about it. And of course, we'll talk about requesting for these health products and technologies. How do we do it? Why do we do it? And the most important thing is to, at the end of this all, remember, you might not be a technical person when it comes to issues of doing the HPT commodity management cycle, but we must have an understanding as to how is it done? Is it being done correctly? And is it done with the best of qualities? And how do you ensure quality? Like I said, by the SOPs. So at a glance, this is an SOP for writing or for developing SOPs. How does this come about? What are these particular aspects that make up an SOP? You can see a number of things here, and this is just part of it. Of course, for you to know how many pages there are in the SOP, you can just look to the right of your screen. It's written 5 pages. It just goes to show you, even the SOP for SOP, it can be 5 pages, it can be 3 pages, it can be 2 or 1 page. You can see something that's akin to a header. What is this document? This document is a SOP. It's just written at the top. What defines an SOP? We have an SOP number there. There are some acronyms there that we are not really sure what they mean. We'll learn that as we go on. There's an edition is just when is this the first SOP, is it the second SOP, the location, where is this SOP going to be domiciled at? And of course, the title of the SOP, it's an SOP for writing SOPs. And if you're looking at the top as well, you can also see the effective date of this SOP. Remember, with knowledge, we have to continuously learn. Therefore, even an SOP does not exist for eternity. An SOP can be reviewed after a period of time, maybe after new knowledge is learned, or maybe if we learn there's an issue with the procedure that we're doing. So usually SOPs are effective for a period of 2 years, but they could be reviewed even more. There are many types of SOPs, and SOPs cut across not only a department. An SOP cannot just be for the health department. You can have an SOP in agriculture. You can have an SOP in industry. There's SOPs for anything. Remember, for SOPs is just a way of showing that we have a body of knowledge that ensures that we have quality from the beginning to the end. Therefore, I'll just go straight to the things that define an SOP for writing SOPs. We have, after the top part, which I've tried to give a rough definition, we have an objective. Why do we need an SOP? So for developing an SOP for SOP, the objective itself states that we must be able to describe the procedure that we're developing the SOP for. There must be preparation, approval, authorization, control, and revision of the SOP. That is the main objective for an SOP for SOPs. There's a procedure for this. It must be made in a certain way, must be approved by the appropriate authorities. There's a way of control. Remember, quality control is what you're looking for, and when to revise it. We'll talk about scope. Scope just shows what are the basic principles, who are the people are these SOPs going to kind of affect, which particular area of it? Is it Mombasa County Department of Health? Is it agriculture? So for SOPs, because we're in the Department of Health, this is an SOP for Mombasa County for the Department of Health that will
Dr. Nico, are you with us? Dr. Nico? Dr. Nico? Okay, so let's continue as Dr. Nico rejoins. So he had been at the scope, so responsibility. So each team member will have to be clearly identified for each team member. So it will have to be mentioned in each SOPs the role of the in charge, let's say. So the county in charge, the role of the county director, if any, and moving on to accountability. So for the SOPs of SOPs, as for the county manual, we use the county director of health to take the overall accountability for the SOPs. So the tools and resources, you'll have to write them down as a guideline for writing of SOPs, and this will be related or correlated to the actual aspect of commodities that you're preparing the SOP for. So procedures, there will be a number of subheadings in each SOP. To outline, there'll be the title, the objective, the scope, responsibility, accountability, tools and resources required, the procedure, the references, annexure, and abbreviations and acronyms. We'll project a sample SOP that will just give you an outline. So basically, this is the main outline of the SOP. So moving on to the title. The title basically just gives information of the SOP. As Dr. Nico had explained, for example, the current one is SOPs for writing SOPs. So what you normally have is standard operating procedure 4, then you proceed with the actual aspect or the activity you need to detail its execution. So moving on, objective. Objective, here we write the reason for preparing the SOPs. Is it that reporting, requesting, receiving, temperature monitoring? So as per the aspect in mind, that is what you highlight as the objective. Same with the scope. So the scope, this section describes the applicability of the SOP, specifying the department and procedure, process, processes and all that. So responsibility, I'd explained this, I believe. So accountability relative to the category or the level of SOPs. There has to be someone who will take over overall accountability. Easiest will be the department in charge or the department head. So a procedure of how to actually prepare the SOP is you outline the steps to be followed. Then you list all the checks to be carried out. For equipment, the procedures shall outline how you clean, let's say, preparing, switching on, switching off, shutting down, calibration, and such like. And in case of any annexures, you have to enclose them at the end. So for references, obviously, you'll have to cite what was used to prepare the document. If they're not references, feel free to indicate not applicable. So basically will be tools that you use or whatever is important or related to part of the SP that you might have written in abbreviations, or so you attach it for ease of reference and understanding. So abbreviations and acronyms, these are basically abbreviations and acronyms. So these are used and their full forms in alphabetical order. Again, in case you don't have any, feel free to indicate not applicable. So the key format requirements for an SOP are you prepare all the SOPs as per specification that have been given. Standard font is the Gill Sans MT, 12-point black. I know we tend to lean on Times New Roman, but this is the specified or recommended font, and use number bullets only. So there's a page setup, the margins are all there that you've seen, the margin, the page size, and the layout. So the header, again, this is basically what I'd already said. So for numbering systems of SOPs, each SOP will have a unique numbering system consisting of alphanumeric characters. So moving on. Example, you can have MC farm. MC for us, we use MC for Mombasa County. So you can justify it. If you are, let's say Likoni, you want to use LSCH, feel free. So moving on, where was I? Yeah. The last two letters for us was MC, donating Mombasa County. So this you'll put what's applicable to you. The next letters denote the department. In this case, pharmacy. It can be lab, it can be any other. Then the last three numericals after the hyphen are sequential numbers starting from the first to the last, as per your order or number of SOPs that you have. Meaning in this case, the first SOP for pharmacy department will be MC Farm 001. For the lab department will be MC Lab 00, that one. So the contents of the header, I believe Dr. Nico had already taken us through this.